The National Authority for the Campaign Against Alcohol and Drug Abuse is a semi-autonomous state corporation under the Ministry of Interior and Coordination of National Government. It's been in existence for a while, and its main job is to steer the country away from alcohol and drug abuse. The acting CEO of NACADA is Professor John Muteti. He's our next guest in the studio. Good morning, Professor.
Good morning.
Welcome to Kenya's biggest conversation.
Thank you.
That's the hot seat of the Situation Room. We're going to have an interesting conversation on the burden of alcohol and drug abuse in Kenya and what you are doing to take us away from that. But to welcome you to the conversation, here is C.T. Muga with the day's proverb.
Yes, our proverbs for the whole of this week are from the country of Lesotho. Written Lesotho, but pronounced Lesotho. Sickness accompanies a waning moon. A new moon cures diseases.
Professor Muteti, when you hear this proverb, what comes to mind?
We are saying sickness accompanies a
Waning moon.
waning moon. And a new moon
Cures diseases.
cures diseases. Well, that's from Lesotho. That's an African proverb from Lesotho. I think when I hear this, the way, well, just quickly, what goes to my mind is that a new moon cures diseases, meaning that fresh ideas might bring better results. You know, a new moon cures diseases.
Yes.
Fresh look at things, you know, might bring fresh ideas and successes and things like that. Yeah.
So it's important to acknowledge and appreciate the need to keep refreshing.
Yeah, new things, new ways of doing things. Yeah, new happenings. You know, you look at them. You know, if it's a new moon and the new moon cures diseases, I look at curing disease as something positive.
Yeah.
You know, something refreshing, something new, something useful, something which brings happy endings.
Like what could be happening at NACADA now, for example. There's a change of leadership. That change could be a cure of disease.
A new vision, a
injection
new way of doing
of
things.
energy.
Yeah.
A new moon.
A new moon. Tell us about NACADA.
Yeah, thank you, Eric. And NACADA, as you've said, is a semi-autonomous government agency. And basically our mandate is to educate the public about the dangers of alcohol and drug abuse. We also, you know, do enforcement, because we have laws and regulations which govern the consumption, the sale, the manufacturing of alcohol. So we are a regulator. We regulate such that if you have to open an outlet, an alcohol outlet, what are the kind of laws, regulations which you should follow? You see, so we do enforcement. We also look at hard drugs like heroin and so on, and then we tell the public, you know, you are not supposed, these are dangerous drugs. We educate the public, you know, on those things. We also look at rehabilitation. We do rehabilitation. We help people who are addicted to seek rehabilitation, services. You tell them where to get such services.
What's the difference between use and abuse?
Yeah, well, that's a technical term. You know, for a lay person, of course, the use and abuse are more or less the same. But we are saying, you know, for example, people take beer, you know, and if you take beer responsibly, of course, that is use. But if you are taking it not just for social purposes, but so that you can get drunk and, you know, forget your miseries and problems, then that's misuse. For us, we are saying you have to be responsible. And in developed countries, by the way, we never hear of this problem of alcohol. It's never mentioned. It's actually their problem is the drug problem. If you go to countries like the UK, you cannot talk about alcohol being a problem. A very small percentage are addicted to alcohol because of responsible use. If you go to a bar and ask for alcohol, a pint of alcohol, they will sell you, maybe 1, 2. When they realize that you are getting drunk, they will not sell you anymore, because it's not about money. Okay, maybe it is about money, but to them they start responsible. In Kenya, if you go to a bar and you ask for a crate of beer, they will bring it to you. You drink that crate of beer. You drink. Even if you are drunk, you ask for another crate, they will still bring it to you. Irresponsible.
Customer is king.
That's the fact of the matter.
But then again, is abuse the same as addiction?
Not necessarily. You see, if you abuse consistently, of course, you are likely to be addicted. If you continue abusing and misusing, so that if I have a problem, I will rush to the bar and I will take as many as I can. Then, of course, progressively you get addicted, because when you get addicted, it means that you get dependent. You get dependent to that particular substance. It means that you cannot do without it. Such that if you face a challenge, they start urge always to, if you get 1 day or 2 days without it, you feel that it's a change in your system. You see, now that is dependency, which leads to addiction. Yeah.
Okay. Let's look at Kenya and now the work that NACADA is doing and the things that we have seen over the last 2 to 3 years. An analysis, should I say, was done a couple of weeks ago, and it came out to say certain things about Kenya being a drinking nation, about young people being then involved in abusive relationships with alcohol, addictive relationships with alcohol and drugs. From what you see, what is the current state of Kenya's drinking problem?
Kenya is a drinking problem. We have a big drinking problem. Kenya, especially the youth, we have a problem. And the problem is such that we find that the youth who are out of school, for example, are drinking more and more. It's a big percentage of the people taking alcohol and also drugs are actually the youth between 24 and 35 years. This problem starts early. It starts in primary schools. Even, because there's the age of initiation, which in our survey, which we did and we released in May, shows that children as low as the age of 6 are taking alcohol. And actually, they take alcohol from their families. They find their father has come up with has got beer in the fridge. They just sip. So they have taken. We are not saying that they are regular takers. They are regular takers of this substance. But they are saying that at least they have taken. They have taken alcohol. And this happens at the home, scene where, you find parents, poor parenting, parents carrying drugs, cigarettes, and taking them at home. And you find the same with cigarettes, cigarettes still, they see their father smoking around. When the father is not around, the kid snatches a stick of cigarette and they go out there and they smoke. So this is a problem which starts there. It goes to primary schools. You find that a good percentage of kids in primary schools are also smoking, and they are also taking alcohol. They progress to secondary schools. The problem becomes worse. By the time they have reached the university, it is actually a disastrous situation. It is a bad situation. And there are some people who now exit to the public now. And the problems.
The influence of the home setup, the power of example, the power of role modeling. That's the introduction. But unless the parents encourage the behavior, what then makes the young people stay with that experiment? Because at the age of 6, 7, even 10 or teenage, they're experimenting. They haven't gotten themselves addicted, so to speak. They are still experimenting. But for that habit to be enforced, what other factor plays into this?
Of course, there is the peer pressure. Once the parent is smoking, they are taking beer openly. They even go to the pub with their kids. You see that kind of scenario, and including peer pressure, because their peers in the in school are also taking. Their teachers are taking. It builds a scenario where they don't see nothing wrong. To them, this is normal. It's even fashionable to smoke. You see, now that kind of thing now builds in, because I think the message that it is not fashionable, it is to smoke or to drink, is needs to be reinforced, such that that kind of thinking is taken away from our youth, and I think that is the one which shapes the direction they are gonna take. Yeah.
When you look at the problems that we have or relating to alcohol. We say alcohol and drugs. Alcohol is a drug. Then you talk of addiction. How then does one differentiate, for instance, if you're talking about the consumption of alcohol, somebody who drinks excessively and someone who's an addict?
Oh, well, as I said, that's a technical thing. You see, addiction as different, and those people who are experts in this area will tell you that addiction, you can have addiction which is mild, you can have addiction which is severe, So it depends on the level of addiction, and there is a technical way of measuring such a kind of addiction. You can be able, by taking somebody through various processes, maybe through a particular questionnaire, which is specifically administered to a person to ascertain if they are addicted, and if they are, the level of addiction. So there's a technical way, there's a way to ascertain the levels of addiction. But you see, you may be taking a lot of alcohol, but it may be once or twice, So, once in a while, that is. That may not really lead to addiction. But if you are continuously taking that alcohol and you become dependent, then we can be able to say, depending on the nature which your dependency is taking, that you are addicted to some level. So if it's mild addiction, maybe it means that you have urge to take alcohol, and you may not be able to do without it for a day or two, or you cannot even survive at all without alcohol. There is a way we can measure and tell that yours is a mild addiction, yours is a serious addiction, severe addiction, and this is what we're going to do. These people you find in the rehabs are actually people with severe addiction.
Okay.
Yeah.
Can I go back a little bit, talking about what Kenya's drinking problem is? Obviously, NACADA has seen some of these trends. What are the things that would indicate and say this is a problem? Do we see because younger people are drinking more alcohol, or then getting involved in drugs? Or do we see that there are things that happen as a result of somebody having drunk or taken drugs? Do we see that the effect of this behavior is what would point to there being a problem? Or do we just see people in bars, people in parties, drinking? Or do we see that something worse is happening, and then we take a step back and say, it is as a result of the drinking or drugs that these things are then happening? Whether it is like some of the things we've seen, murders taking place, abuse happening. Can we point back and say the problem is because of the things we see happening as a result, or just because there's the consumption happening?
Yeah, consumption is just one thing. You see, if there is a problem, we are saying that we can see the numbers. For example, we are looking at the numbers right from primary school, secondary school, as I've said, and we do a comparison with other countries, because we are part of the global community, and usually when we carry out surveys, we also do a comparative surveys, and we compare with other countries. So for us to say there's a problem, then we have to look at this from a bigger perspective. How is Uganda doing? How is the Tanzania doing? How are our neighbors and other people in Africa doing? So we have to do a comparative survey, and we compare. That way we can say that, we are not doing very well vis-a-vis other countries. So you see, for them we can say now we have a drink problem. But having said that, you find that if people are drinking, even outside the allowed drinking hours. For example, in Kenya, for a normal, alcohol outlet, you are allowed to open that outlet from 5 to 11. That's a normal outlet. If we find people drinking from 10 in the morning all the way past midnight, then obviously that's a problem. What is this person? I mean, this person is supposed maybe to be doing something useful like working. This person is at the bar, drinking, right through even those hours they are supposed to be working. Even then, we will be able to see that there is a problem here. If you go to some places where you find people have got some bit of disposable income, you find that once they get paid a bit, even if it's 500 shillings, then most of that money they get paid goes to consumption of alcohol instead of taking care of their families in terms of food, in terms of supporting their kids and things like that. Then that points to a problem. So you see, the problem is should be looked at from a wider perspective. Are these people responsible? What percentage of their income are they spending on alcohol? And then we would be able to say this is a problem.
What are the key factors that leads one to this? What leads one to get to this level, this point of abuse and addiction?
Mostly, of course, it is. I would imagine that addiction. By the way, addiction is a disease. We take it as a disease. We don't condemn those people who are addicted. We understand that addiction, either for alcohol or for drugs, is something which people are introduced to. Maybe unknowingly or unknowingly, but once they get hooked, then it becomes a disease. And of course, there are many factors which lead people to get addicted. And as I said, one of them is peer pressure, the kind of company you keep. If my friends, their pastime is getting to the bar at after work or at 1, in the afternoon, then I'm likely to get addicted. Peer pressure. But there is also stress. You can be stressed, and you find that maybe, according to you, the only way to escape stress is to and forget about the problems you have, is to go and have a beer or to have drugs which might help you, feel happy, feel high, so that you can forget those stresses. But you see, that is just that is not the solution, because actually that's a short-term solution, because it is going to solve.
It's a coping mechanism.
Yeah, it's a coping mechanism. It's going to solve the problem for an hour or so. After the effect is gone, then you are there miserable. So it is those kind of things which make people get addicted.
If we just to look at Kenya as a country, what would you say is the biggest of the highest percentage of the substances that are abused? Is it alcohol? Is it drugs? And if drugs, what type of drugs? What other hard drugs? What is the number one most abused substance?
Yeah, actually, alcohol is a drug. And, sometimes we talk of alcohol and drugs. But the fact of the matter is that alcohol is a drug. anything which changes the state of your mind, the state of your thinking, which makes the judgment, which can affect your judgment, changing the state, whether it is a legal or even illegal drug, it is a drug, anything. Even if you go to the pharmacy, the chemist, and you get a drug and something, it's a drug, if it changes your state of being. Therefore, alcohol is actually the number one drug. In Kenya, we find that about 11.8% of Kenyans actually take alcohol. That is the current use now. The current use. The people would say, I take alcohol.
Yeah.
And these we look at it from the point of, have you taken alcohol in the last 30 days? Then we classify you as a current
regular user.
Yes,
as a current user.
Yeah. That's just for purposes of standardization, so that even when we compare ourselves with other countries, that is is a way to compare ourselves. So that's a current user, and therefore we find that quite a big number of Kenyans, that's 11.8% are current users. Then, of course, we have tobacco. We have smokers, smoking. Smoking is the other one, which is also quite, high, which is at 8%. You find that quite a number of Kenyans are smoking. Then, of course, we have people who take, the hard drugs now, the cannabis. The cannabis, and this is a big problem with the youth, because we find that the youth who are between 24 and 35 are actually taking more and more of cannabis. We in the last 5 years, the use of cannabis has doubled. We used to have hardly 1% of Kenyans taking cannabis. Now we are going to nearly 3%. So, the use of cannabis has become too much in Kenya. And this may be as a result of the international scenario, where we hear countries allowing this use. And, it is actually a myth. They are not allowing them for day-to-day use. Most of the countries we are allowing use of cannabis. They are doing it for medicinal purposes. And it is controlled. It is not like you can be smoking it around, And that myth that you can be smoking around and, it's allowed in America, it's allowed in South Africa, wherever. It's just that. It's just a myth. It isn't allowed. It isn't. And cannabis is one of the most dangerous drugs, because once you get hooked, then you start. It's an illusion. You think you are there. Yeah. And therefore, these are the messages we want to tell our youth. These things you read over the internet, these things you read are just myths that, you get any advantage. There's any advantage you get by smoking some of these hard drugs like cannabis. Then, of course, we have prescription drugs. Prescription drugs are drugs which are prescribed by a doctor for purposes of different reasons. If you have a sleeping disorder, you may get a prescription. You may be prescribed a drug which can help you sleep. What has been happening is that kids, especially in primary schools and even secondary schools, are getting these drugs. They are getting these drugs either legally or illegally, and they are being misused. So you find that in our surveys, we find that it has really become a big problem. It's a big problem. And I think when we look at it, the problem starts with the family also, where the mother, the father are also taking the drugs, and the kid now starts taking them, and they become hooked, and the kid now pressures the mother, we not sleeping well, whatever. But they are taking them because it makes them feel because it makes them feel different, it makes them feel more relaxed, and they get hooked as a result.
In the structure of NACADA, who makes the decisions? Is it a board? Is it an executive office? How is it structured?
Yeah. Thank you, Eric. Of course, NACADA being a government parastatal, is managed by a board. There is a board of directors who make policy. They direct policy. And once they come up with a policy, then they give it to the management to implement. So the overall authority of NACADA lies with the board,
Right.
who now oversees the implementation. You know, the implementation is done by the management, but management is answerable to the board.
Okay.
So the work of the board is to make sure that the strategies which have been put in place, the programs, the activities which have been approved by the board are carried out by the management as directed.
Does the NACADA Act say who should sit on the board in terms of representation? Like, for example, having professionals, psychologists, psychiatrists sitting on the board, having people who are in rehab profession sitting in the board, and others such people.
Yeah. The NACADA Act, we have an Act of 2012. That is the act which set up NACADA as a state corporation, and in that act, it is clear who is supposed to be appointed to the board. The chairman of the board is appointed by the president.
Okay.
Then we have members of the board who are directors, who are appointed by the minister in charge. And the minister in charge for now is the minister in charge of Interior. The CS, Interior.
Yep.
And therefore, you find that there are categories. We have a category where the parent ministry is represented, and other government agencies, other government ministries. Who, for example, we have the Treasury being a member of the board. We have a Ministry of Health because of the nature of what we do, being a member of the board. We have the ministry which is in charge of youth, because we deal with the youth matters, because most of this drug problem is actually concerning the youth, because the youth who are most affected. So we have the ministry which is in charge of the youth, also being part of the board. And therefore, depending on the ministry and the way we work with them, they will be part of the board. But also the PS, the PS Interior is represented in the board, because that is our parent ministry. We also have other categories of directors appointed. We have institutions like the faith-based institutions, the religious organizations. They are supposed to have a representation. So we have two members who are supposed to come from the faith-based institutions, like the Catholic, the Pentecostal, the NCCK, and all those others. They are supposed to have a representation in the board. And then we have the medical practitioners. The medical practitioners are supposed to have a member representing them. So that is also another category. We also have independent members, people who are not affiliated to any of those categories I've mentioned. And these are independent members who represent who represent the public, let's say. And therefore, those are also supposed to be represented in the board.
To the best of your knowledge, since the initial NACADA board, has there been a board member who has been an addict?
Yeah, like currently our vice chair, actually, we have a lady called Anne Matthew. She was, but of course she is reformed now. She's the vice chair, and she's been everywhere. And I think one of these days you may want to talk to her. She has been an addict. She has the experience of addiction,
right?
And she would really be able to take people through that journey of being an addict and getting reformed, going to a rehab, and now reforming and being free from addiction. So we have had, and our vice chair has been, and she has been in the media,
what gains are being made on pulling back on this issue? And I'm still on the matter that because of abuse and addiction, other things happen which can be avoided. We also see the mental health burden in this country quite heavy. It has been called, or it has been given status of national emergency, right? And in many cases, those who study the mental health burden will say that almost always there is the inclusion of drug and alcohol abuse or addiction here. What are the gains that have been made to say, this is what has been established, this is the problem that we see, this is how we're going to start cutting back on the infiltration of the vice? What are some things that you've actually realized and said, okay, we've seen that it's a problem, but it is getting better?
Yeah, thank you. Of course, we have gains, and these gains are as a result of the strategies we are putting in place, or we have put in place. One of the things we've realized is that if you use the community themselves, if we engage the community, we are likely to get more positive results as far as addiction and the management of addiction and treatment of addiction is concerned. You see, you know we have rehabs. Mm-hmm. You can take somebody to a rehab, but the relapse rate of people who go to rehabs are very high. You take somebody there, and you find that hardly 10% of the people coming out of rehabs really see it through for years and years. They relapse. And the reason is because the nature of rehabilitation is such that you get treated outside your normal environment. You see, you are going there for 3 months, you are taken through, but once you are taken back to your normal environment at home, then things change because there is no follow-up, there is no reintegration, and you are likely to be tempted. The same people you left, the peer pressure, the same friends who used to be drinking buddies, you still find them there. So you are likely to be drawn back to such a kind of behavior again. I think if you get rehabilitated from an environment which you are familiar with, and that is the local community, so that it's a home care kind of scenario, and that's what we are exploring, then you are likely to sustain the non-addiction kind of path, because you are with your friends who you are been drinking with, and you are getting rehabilitated at that scenario. You can see the alcohol there. You are getting tempted, but you restrain yourself, and you know that kind of scenario. So we are thinking that if we can have more home-based care, more of a community getting involved in rehabilitation, then we are likely to have more gains. We are likely to sustain such gains. Addiction is very expensive, because it takes other than even the health bill, the health cost of addiction, where you are getting sick, it's very expensive. And if you are getting addicted, then even if you are working, you can imagine the man hours, the woman hours, which you lose as a result of not going to work and all that. The labor force was greatly affected by addiction. Addiction actually affects the economy of this country. Actually, it is such that if we look at, and we are also trying to look at the real cost of addiction, which includes all these things I'm talking about, and you are likely to find that it will be a huge burden to the country. So what we are saying is that let's look at the best ways to bring down this vice, this addiction, and let's involve everybody. We know that the people who are selling some of these things like drugs and so on are out there, the barons. They are quite powerful, and I'm sure you will ask me, what's happening? Why are they not? Why are you not getting these drug barons? Where are they? We don't see them.
Muteti, why are you not getting these drug barons? Where are they? What is happening with them?
What will you do to them?
Yeah. America is one of the most powerful countries in this world. It has a very bad, worst, drug problems, and these countries with all the resources they have. But I think the problem is, and in our country, the problem is the culture we have, such that I am a law enforcement officer. I know that these persons are not supposed to be brewing illegal alcohol, but because I'm getting something small, I don't know if it's small or big, I'm getting something, I will look the other way, and I know that every day I'll be passing through there, and I will be getting something out of it.
But Prof, don't you think that for many people who perhaps may be in law enforcement, they don't see alcohol consumption as a problem until it is something that has confronted them and they have seen the effects of it? Because they'll say,
like a licensed.
Yes. And also remember, if you, for instance, compare it with gender-based violence, part of the reasons why gender-based violence doesn't make as much traction as it could, because you go to report to someone and say, what happened? You quarreled. Okay, he beat you, and then it's the severity and the seriousness of the matter. When you throw in the cultural perspective that people grow up with, the problem as it actually is not seen in that light. So the actions that people ought to take against it, they actually don't, until it is so in their face, they have no option but to confront it for what it is.
That's true. I think it's the mindset also. The mindset that's such that, this is normal. This is normal. Until it also happens to you. Some things maybe they are coming closer to you. If your brother, if your father, your brother, your sister are addicted, then you will now realize, this is a problem. I agree. Sometimes, we look at this thing as just normal, but the truth of the matter is that this kind of addiction is serious to those who are carrying the burden. You may be not the one, but you can be affected, because if you are somebody, for example, let's talk of the hard drugs, heroin, cocaine, and such. These people, when they get addicted to such hard drugs, they can hardly do without. They have either to steal from you, they have to get this after injecting themselves at whatever cost. They can do whatever it takes. And therefore, if you are in a family with such a kind of problem, then you feel the pinch. So actually the mindset that this is not a problem until it affects you is also a problem which we also find. But
that is why NACADA has a mandate of creating awareness.
Yeah.
All right, to change those perceptions. Do you think that NACADA has done a good job on that?
Well, I want to defend ourselves, but what we know is that we are now trying to put in place systems where this information is passed right to the community. And what we do is that sometimes when we sit, when we're talking from the national platforms or, to a few people, the message may not get through. We think that we can do better as NACADA. And for us to do better, this information must be passed by the community themselves. We empower the community.
Why hasn't NACADA done that since?
You see, we have been doing it, but not as strongly as we would have wanted to, because of course these things require resources.
Okay,
to get it to every community.
You've
in this
gotten
country.
there. Yeah. What is the budgetary allocation for NACADA in this new financial year?
We are hardly doing $1 billion, and this is an outfit for you to.
What is your wish list?
I would imagine that for NACADA to effectively perform its mandate, including getting to the communities there, establishing ourselves at the lowest level, then we may need to have something like 1.5 billion Kenya shillings every year to do that kind of job.
Why not even twice that amount? Because if you are talking about NACADA as it's currently nestled in the Ministry of Interior, and yet it's a health problem, so the Ministry of Health is involved. It involves young people, so the Ministry of Education will be involved. In fact, the only place where you don't get it involved directly is probably a ministry that deals with the environment. But then again, some of the products that cause these problems are
environmental issues.
Yes, because one could argue that they're vegetables or they're plants or they're trees or herbs. So,
yeah, you see, we us as an organization, we don't work alone. We also coordinate and collaborate. So that if we are doing enforcement, for example, we will use the police. So it's the resources the police are using. We will use the assistant chiefs. It's the resources of assistant chiefs. We use the Ministry of Health, to do counseling and such a things. You see, such a kind of collaboration.
That's on the curative side and on the enforcement side.
Yeah.
But like you say, the
public,
bigger one is the preventive and promotive side, which requires you to be actively campaigning.
That's true.
What percentage of your current budget? You said it's less than $1 billion. How much is it? Is it 800 million?
It's about 1 billion actually.
It's $1 billion.
Yeah.
What percentage of these billion shillings are you dedicating to awareness, community engagement?
Out of the, we have programs. Of course, as a government entity, you're supposed to pay salaries and so on. So as a government, as it's a program, it's a whole given program like that. We give like 30% for such program, which includes public education.
So 300 million shillings for public education.
Yeah.
Okay.
And the other 700 million shillings.
Now that will be for enforcement, that will be used for rehabilitation, that will be used for paying salaries for the government employees, that will be used for many, many other things.
Okay. Do you think this percentage, this split is good enough to
Not
do
good
the
enough.
things that
we must do better. I wouldn't say it's good enough. We must do better. More of this money should go to programs. If we can have a scenario, and I'm still insisting that if we can have the community doing it, we empower the community. The community will do it on our behalf, on behalf of everybody. The secret is to empower the community. Because we have what we are calling community forums now. We are setting up community forums. So that if you go to my small village there, you will find a community, a forum, where we have the local administration there, we have the local leadership, the opinion leaders, we have the local church, we have everybody, including the Numbakumi, making decisions on how they should handle these alcohol and drug abuse challenge, where they will be able to say, this person is carrying out illegal brewing, what action are we going to take? This person is selling bang, and we cannot allow it. We get that information, what are we going to do about it? At that local level, you see, and that is where we are aiming at, empowering the local community so that they can take this, because it is their problem. It is not nobody's problem, it is their problem. When their sons and daughters get hooked, then they are the ones facing the burden. And they are the ones who would be able to say, no, we don't want this thing. We need to empower them.
Okay. So you agree, Prof, that for that to happen, the community needs to feel NACADA.
It needs to.
The community needs to look around and see NACADA.
It needs to.
Needs to engage with NACADA.
It needs
not only engaging with the chief who's conducting the raids and government officials who are saying we will crack down on alcohol in this country.
I agree. It boils down to the community.
Okay.
We cannot run away from the community. We must empower the community.
Asante sana. Prof, thank you very much for joining us today. It's been a good conversation, and we hope to have you again soon to see what NACADA is doing going forward to address this big issue in the country, the burden of alcohol and drug abuse in Kenya. Professor John Muteti, the Acting Chief Executive Officer of the National Authority for the Campaign Against Drug and Alcohol Abuse, he's been our guest this morning. And as we send you off, Prof, we ask you please pass by Naivas or send people to go to Naivas and let them buy Colgate, because buying Colgate is helping spread a smile across the country.
I will do that.
This is the Situation Room, the only way to start your day.